September. Other things is National Suicide Prevention Month. Tonight concludes our week-long focus on suicide and mental health with a conversation with a professional counselor. With me tonight is Carlos Taylor, and he provides individual, group, substance abuse, and other therapy. He's been a professional since 2018, graduated from my alma mater, Cameron University. Yes. Anyway, he has a master's in psychology, and thank you so much for taking time to talk to us tonight.
Thank you for having me.
Well, so much we want to talk about, but when people are going through a lot of things, when is a good time to seek out therapy? I mean, when it first starts, in the middle, or where?
I would say when it first starts, so it doesn't build up, compile, and then you have an spillover, outburst, things escalate, and that's when things could go further than they need to if you seek help, as soon as you feel like something is wrong.
There's such a stigma to some cultures to getting therapy. How do you overcome that?
Representation. So being African American and Native American, it is more of a safe space when clients can come and sit and look at you and talk, and we have that unspoken language between each other. So it helps out a lot.
What about age? Does that matter? Are older people more likely to get counseling or not?
Some I've noticed older people are getting counseling more than what was said to not be a thing in the past. But we're kind of bridging the gap with technology and media and just bringing awareness.
But millennials are heading to the couch, right?
Yes, they are.
Couples, family conflict, grief counseling, bereavement, all kinds of things. Just today, we heard on the scanner, a woman had a bottle of pills in her hands. Her kids were fighting, and she was just at her wit's end. My goodness, it could be anything that pushes someone to the thought of suicide.
Yes, anything. And that's why I always say, check on your people. You never know what somebody's going through, and just really thoroughly observe your loved ones. And if you think somebody's going through something, sit and have a conversation with them or refer them to somebody.
Oh, that is a good idea. Many times people have a lot of thoughts in their head and all, but when should they themselves be alarmed with the things they're thinking?
If things get to the point where you feel like harming yourself or harming others, then I think it's a good time to seek help or counsel from anybody. You can reach out to your pastor, to anybody that's in a position to talk to you and help, and then you can take that further and seek professional help.
Okay, any last minute thoughts that you'd like to share?
Yes, just take care of yourselves, self-care, and just awareness about mental health.
Wow, that is great. Thank you so much for being with us.
Thank you for having me.
All right. If you or anyone you know is struggling with suicide, help is available. We encourage you to speak with someone today by calling 988 Suicide and Crisis Lifeline.